Hi, I'm Michael Curtis, a PhD student from the Burnett Institute in Monash University, and my presentation will discuss a preliminary analysis of the resumption of regular injecting drug use following release from prison. Here are our disclosures. So we know that people who inject drugs are disproportionately incarcerated globally, and having an improved understanding of factors associated with the return to regular injecting drug use following periods of imprisonment is critical to support successful community reintegration. Previous research has identified a number of factors associated with the resumption of injecting drug use following release from prison. So data for this preliminary analysis came from the Prison and Transition Health Cohort Study, which is a prospective study of 400 Victorian men who regularly injected drugs prior to imprisonment. Participants were interviewed in prison within 12 weeks of release and then followed up 3, 12 and 24 months after release. We define the resumption of regular injecting drug use as at least 5 episodes of self-reported injecting drug use in the month before interview. And in order to explore the timing of and factors associated with the resumption of regular injecting drug use following release, we conducted a single event, discrete time survival analysis. 336 participants completed at least one follow-up interview and were included in the analysis. Overall, 55% of PATH participants resumed regular injecting drug use during study follow-up, and incidence was greatest between release and first follow-up, where 141 participants resumed regular injecting. The items in bold were significantly associated with the resumption of regular injecting drug use. Poor mental health as assessed by the GHQ-12, being in unstable accommodation, reporting polysubstance use in the month prior to imprisonment, and being on a community corrections order were all associated with an increased hazard of resuming regular injecting drug use. Somewhat surprisingly, living with a partner was also associated with an increased hazard of resumption of regular injecting drug use. Engagement with drug or alcohol treatment services was engaged with a significantly reduced hazard of resumption of regular injecting drug use. So we found more than half of our cohort resumed regular injecting drug use following release from prison, with the majority doing so between release and first follow-up, which occurred approximately 90 days after release from prison. Our findings suggest that returning into unstable accommodation or social networks where injecting drug use is prevalent may promote a more rapid return to injecting drug use. Our findings also highlight a number of avenues for intervention to minimise the resumption of regular injecting drug use following release from prison. And we're currently awaiting linked data from Corrections Victoria, which will detail reincarceration amongst the cohort. And that will enable us to conduct a multiple event discrete time survival analysis, which will also adjust for time at risk in the community.